Okay, so hi and welcome to another episode of the Able to Care podcast. I'm your host, Andy Baker, and joining me as usual is my co-host, Nadine Sutton.
Hi.
Hello. And we've got a special guest with us again on this episode. So we're joined by Joe Jackson. So thank you very much for joining us, Joe. Thanks for coming over. So Joe's travelled up from the wet streets from Rutland, or Oakham, isn't it, that you've come from. So thank you very much for joining us and taking the journey. So today's episode, we're going to kind of mix it up a little bit, I think. So the focus predominantly is going to be on epilepsy. And Joe has lived experience of living with epilepsy for, first Seizure, you said it was about 13 years old. Yeah. Do you mind if I ask how old you are now?
22.
22. Okay, so it's been a fair while you've had that condition. Yeah, nearly 10 years you've experienced it. Joe also has a few other conditions as well that we might talk about as we're going through, but we thought we'd do one predominantly on epilepsy, and I'm sure we'll touch on a few of those bits and how those affected your life, if that's okay as we go through.
Yeah, that's fine.
All right, fantastic. So do you want to start off telling us, if we focus on the epilepsy side, you said it was 13.
Yeah.
Can you remember what happened, what led up to, what happened during, what happened afterwards?
So we were having a Sunday lunch, and I was with my granddad, my brother, my granddad's partner at the time, and my mum. And we're all sat at the table. I just finished. I was starting to walk towards the living room, and Mum heard a crash, and I was falling down by the side of a radiator.
Right.
And I was having a seizure. I grazed all my left shoulder from it.
Right.
And that's when the first one happened.
Right, okay. Do you know how long you were having the seizure for?
Mum said that one was only for about a minute and a half.
Right,
so it wasn't a long one. But obviously, because it was the first time that it happened, they did call out an ambulance to come and check over and stuff to make sure that everything was okay.
How did you feel afterwards? Can you remember?
I can't really remember because it was such a long time ago now. So, but no, I just remember being really tired after it. And then obviously I did stay in hospital overnight in Peterborough. And they said they did a few more tests like CT scans and things.
Right, okay.
Just to check over. And that obviously at the time they thought that one would just be maybe a one-off thing.
Right.
But then once they started looking into it a bit more, then they said that might be not the case. They got me on medication straight after that.
Okay.
And then I had one again a couple of years later. Yeah. When I was starting secondary school.
Okay.
And I had quite a few throughout my time at secondary school.
Right. Okay.
So yeah,
that must have been quite challenging to kind of been living with that at the time.
Not really. I mean, I had a good solid friendship core group, right? So they always looked out for me.
Oh, that's good.
To make sure I was fine. And then the teachers were fantastic.
Oh, okay.
They were all really good.
Yeah.
So they always kind of knew what to do in that situation. I think schools have definitely improved.
Yeah.
On like people with learning difficulties and trying to be a bit more proactive when it comes to things like that.
Yeah, definitely. Yeah. There's definitely an improvement across the board, isn't there, as far as...
Yeah, that's it. And there does seem to be an influx of teachers and schools wanting to have medication training as well. So being aware of things like rescue medication if a person needs it for epilepsy. And again, just having those general...
Yeah, I do have rescue medication.
Oh, do you?
Yeah. Apparently, I think it's only meant to be used if it's over 5 minutes long. I can't remember what it's called.
Buckle?
Yeah, buckle, that's it.
Buckle.
If it gets
when Nadine steps in.
Midazolam or something.
That's
so there's actually another word in there, but I won't go into it. I can't pronounce it. Or a skull or something. Buckle or a skull midazolam. So yeah.
Is that the most common rescue medication?
It's used. It's common brand. We've got Epistatus as well, but buckle midazolam is a really, really common brand, definitely. Yeah. And it comes in different sort of sizes and so milliliters dose wise. So yeah.
I don't think everybody with epilepsy gets rescue meds.
No,
everybody does.
I don't know why they gave it to me because obviously I haven't had that many.
Yeah.
But I think at the time they just wanted me to have it just on me just in case. So it was always in school for when I had it. So,
you said that first one lasted you about 1.5 minutes. Have you had ones that have lasted for longer than 5 minutes sometimes?
Not that I'm aware of. I mean, a couple of my seizures have been unwitnessed, so who knows how long they could have been.
Right.
But obviously, I don't think that usually they're only a couple of minutes and then that's it.
Right. Yeah, this is the problem as well. So when the buckles obviously prescribed to people, it is because sometimes we don't know how long people have been having seizures for. And we usually administer the rescue medication after 5 minutes. That's when it's perceived to be potentially life-threatening and dangerous. So that's what the rescue medication's for. And like you said, if you've had a couple of unwitnessed seizures, there's no telling. So it would have been erring on the side of caution that we don't know. So it's best to have that for best practice, really.
See, I'd heard of cluster seizures where they have it's where you come out of recovery or you don't go into recovery, you go straight back into seizure again and again and again. And that's what I thought it was originally for, to stop somebody from progressing and going into. But it can be anything over 5 minutes.
Anything over 5 minutes, no matter what type of seizure or anything like that. That's the general rule of thumb nowadays.
Yeah. A lot of my knowledge around epilepsy is purely the first aid side of things and teaching that. And that's about as deep as it goes. So I'm learning too.
Quick question then. How many forms of, or how many different types of epilepsy do you guys know?
So I think I know, but I do.
Is there 5?
5. So there's... No. So there's around about 40.
I had 46. I thought it was 46, 42.
42 to 46. I've got my notes
types of seizures. I thought you meant like tonic.
So
I think it is, yeah. So I think there's 46 different types of seizures, yeah. So you got your tonic and your clonic and your myotonic and your tonic seizures.
So there are over 40 different. So this is the most up-to-date information. Right. Over 40 different types of seizures. But the International League Against Epilepsy identify 3 main types. So they are categorised and broken down into 3.
Yeah.
Seizures of unknown onset is actually one. So that's where your first one might have been labelled as, or it could still be labelled now for whatever reasons. But there's a lot of people that only have one seizure and then never have one again, but then they will may still have that diagnosis of epilepsy.
So you said that you've been having seizures up until, you said 1.5 years ago?
Yeah.
The last one was 1.5 years ago. Do you know what changed? Did anything, was it medication change?
Medication was upped. So they did up my dose.
Okay.
My medication back then hadn't been reviewed in a long time. I think it was 2 years since I'd been last reviewed, because they'd signed me off and they thought, you know what, it might be okay. So they signed me off.
So when your last seizure was 1.5 years ago, is that the last one that you remember? And was
last one I remember. I don't think I've had any other ones since. And again, stress is a lot of factors.
I was going to say, do you know what a big factor is?
Stress for me, when I had that seizure, I was going through a lot of stress at the time. Just started working for Home Straight. Leaving another job where things weren't great. They weren't left on great terms and stuff. And it just caused a lot of stress.
You said you had one, and that's what I wondered, whether when you started the new school and stuff, you then had a seizure. I think that's what you said, didn't it? So, when you were at 13.
I don't know if that was a reason for it. I think back then my medication again was low compared, and obviously puberty came along and hormones and everything. I was going to
say hormones can play a big trigger factor.
So obviously growing
sounds
up,
like you had more in that time period than you have in other parts of your life as well. So puberty seems to have been a bit of a trigger for it.
So
lovely that you had support around you though. That's really, really important.
Yeah, that was nice to hear.
My friends were fantastic. I remember once I had one in the school canteen.
Right.
And I was sitting with my friend. He pushed all the tables out the way to make sure that I was safe enough. And then another friend went and got one staff members to come over and have a look.
That's good.
And they were really good friends and still talk to them to this day.
Oh, that's awesome.
So yeah.
Did you ever kind of educate your friends or tell them about what to do in circumstances, or they looked it up themselves? Or
looking back on it, like we never really like discussed about it. Yeah, we just talked about usual stuff that boys talk about. Yeah. At that age.
It's not a common chat. No. Let's talk about my epilepsy.
No, so I think maybe, I don't know if they did read up on it or not, but they might have had a look into it.
Yeah.
I mean, my friend who moved all the tables out the way, he was quite a smart kid, so he knew quite a lot of stuff that were years beyond us at the time.
Right.
So
an element of probably seen teachers manage it and stuff and seen what they did and kind of just going, we just need to keep him safe in that moment. Yeah, definitely.
I think it's really good that you did have a really smart friend, because I know a lot of people may panic with seizures. It's that kind of, well, what do we do? There's a lot of old rules and stigma as well, so make sure you stick a spoon down on someone's tongue to hold the tongue down, and think so nobody ever do that ever. That's definitely out the window. But it's really nice that he actually moved the tables out of the way and things like that. I think that's a really positive thing, definitely.
There is some still misunderstandings out there as far as, from a first aid point of view. You don't restrain them, you make the area safe for the individual. So moving the tables away was exactly the right thing to do. And so don't stick things in the mouth. I think people worry about swallowing their own tongue, biting their own tongue, and those things like that. So there's a lot of
so make sure you hold somebody's head. We don't hold anybody's head, we just cushion it if we're able to. Anything, just try and protect the person as much as possible, but never go into restraint.
100%. We'll just put that out there, make sure people know. So you said obviously you let us know at the beginning that you have a condition called DiGeorge syndrome. Have I pronounced that right? Yeah. Okay. Is epilepsy linked to that? Is that something? Yeah.
So DiGeorge syndrome is a chromosome disorder, and it's where you have one less chromosome than everyone else.
Yeah.
That's as much as I know. That's as much as I can say at the minute without looking into it a bit or on Google and that. But that's as far as what I'm concerned, that the epilepsy is linked into that.
Yeah. And that's what the doctors have come back and said, and sort of said there's nothing else going on in there. It's just linked to that syndrome, basically. Yeah.
It's one of the symptoms about it as well.
Yeah. What are the other things that you found with having the syndrome? What from your point of view, what are the differences?
Well, I remember my mum saying and reading up on it, and when she was reading up about it, she said mental health can be a big part of the issue. So obviously I have struggled with mental health. Yeah. Especially through COVID and lockdown and all that.
What was it about that time that kind of felt difficult?
Just the isolation, not being able... I mean, I was quite an isolated person anyway. I like to keep to myself. But even then, I still went out. I still went out like maybe once every 2 weeks. I wasn't even allowed to do that. Yeah. During lockdown, it was literally going to work, which was for me at the time down the road from where I was living.
Right. Okay.
So I had a little walk to work in the morning, walked back, did 12 hours, came back home. And that was it. And that was life for 6 or 7 months. And it just drove me insane because I couldn't do anything on my days off. I just really struggled with it.
Is there a particular area related to mental health that you struggle with more? Is it kind of anxiety, depression? What would you say is or is it a bit of both?
I would say it's a bit of both, and I think a lot of it is to do with isolation as well. I'm not the most social person. I don't really go out that often, but I still like to be around people. But when you're stuck at home with your parents, it's not exactly the greatest thing on the world, is it?
I'll have to cut that bit out.
So that's my son over there filming this, and he agrees wholeheartedly. So one of the things you mentioned when we were talking about DiGeorge syndrome, that it's on the autistic spectrum, or there is close connections with autism.
Yes, anyway. So there is close connections with autism. I'm not 100% sure if it's on the autistic spectrum. Yeah. But I believe it is.
You have a lot of symptoms and stuff. That
can come out. So like I fidget a lot. Right. I that's why I like my video games and stuff, because my fingers are always busy and stuff. That's why probably smoke as well because I like strong
yeah
things and strong senses.
All the smells and the tastes and stuff. Yeah. So there's some sensory aspects of what you. Yeah. So are you a bit? Are you it's like sensory seeking slightly? Then you seek movement, you seek smells, or is it kind of avoidant? Is there things like noises and stuff like that you find difficult?
Sometimes I do struggle in crowded rooms.
Right.
Crowded rooms, I do get a bit apprehensive around. Like sometimes if I go to the pub and it's really busy.
Yeah.
And like I go for one drink and then I'm like, that's enough for me. And the guys who I go to the pub with, they are quite loud.
Right.
So they are quite loud. Lovely guys, but they're a loud bunch.
Right, yeah.
So sometimes it's just a bit overwhelming and I just say to my dad, I just need to go home.
Time to go, yeah.
Too much.
Does it tend to be worse when you're tired and things like that as well? Or could it just be day to day? Day to day.
Not necessarily when I'm tired. I think I've always struggled around big crowds. So yeah.
I think the reason I raised that and I kind of draw attention to that in that moment is because you've just been mentioning there about how the social isolation is something that affected your mental well-being and stuff, and not having that ability to connect with certain close people and stuff. And I thought that's quite worthwhile kind of linking across, because I think there's sometimes a misunderstanding related to those on the autistic spectrum that they don't like people or they don't want to be around people. And it's a case of you want to be able to have that space, but also people are massively important to you. So I think it's quite useful to kind of address that stereotype, if you like, at that point.
Obviously my friends, they're really close to me.
Yeah.
And I do enjoy seeing them. Yeah. Maybe not as much as a normal person would.
Yep.
But yeah, I do like them.
That might just
because I don't talk to them every day.
Yeah.
Like say my brother would.
Yeah.
Doesn't mean I don't like them or anything. It just means that sometimes you can't bother to talk to them or something. So
they don't feel important to you in that moment. Yeah, absolutely.
Yeah.
Yeah. But it's nice that you kind of picked up on that of so related to your mental health. I take it you have to be quite on the ball a little bit with the syndrome and the links to mental health. You have to be quite on the ball related to that.
Yeah.
So self-care and being aware of what works for you and what doesn't.
Yeah. So I do have really good family support group. My stepmom, she's been a massive help through the years, and my mum as well.
Yeah.
My dad as well. Even my brother, younger brother, who's fine as Larry now, he's 19.
Right.
And when I was going through a really bad mental health patch, he was only 15 at the time, but he was still there.
Yeah.
Thought for a 15-year-old, that's quite a lot to take on.
Yeah.
So
definitely.
Yeah, my family were fantastic throughout that time that I was struggling.
100%.
Yeah.
That's good. So have you found ever that your epilepsy has impacted on your mental health at all?
I think if we put stress into mental health as well, then definitely, but other stuff, no, not really.
Yeah.
I think stress is just one of the things that probably induces a seizure.
So it's a cause or triggers it slightly. Have you ever experienced like self-consciousness or anything around your epilepsy, or have you always kind of, because maybe it wasn't regular enough for you to worry about it too much? I don't know whether it was when it was happening regularly where it became a bit of a thing for you. But
I never really worried about it because I always knew I was going to be okay. So I've never really worried about it.
Yeah.
Obviously, I'm not been able to drive yet, but hopefully soon once I get my theory.
I think it's a year, isn't it?
I'm a year and a half now, so that's why I've got my scooter, which will help me get around and stuff.
Oh, well, congratulations.
It's
nice to have a taste of freedom.
So freedom in your life.
Yeah, my dad got it for me, so he's said have a little bit more freedom.
Dad's winning.
Yeah. Have a little bit more freedom around, so he says, and then see how you feel on that, and then maybe we'll look into getting a car in a year or so after you bit more road aware as well. So it's all to help with that.
And I think that's again another thing worth mentioning, isn't it? As far as I think there's a stereotype or a misunderstanding that somebody with epilepsy can't drive, but say yes, you have to meet certain criteria if you kind of had a seizure for a year and a half, and I'm sure that's understandable. But it's something that doesn't have to hold people back, especially if they get their medications or those sort of things. Have you ever had? So I take it you were working when you had during that time period as well, when you had when you were experiencing seizures. Did the employer make any reasonable adjustments, or was that something that was discussed with
Again, with epilepsy, it's very hard to make reasonable adjustments because they can come on at any time.
Yeah.
So you can't really get reasonable adjustments made.
Yeah.
For
it's a hard one, isn't it? I think from their perspective, it'd be a case of managing the risk. So when was the last time you had one? What actually happens when you do have one? What types of seizures do you have? That would determine whether you loan work and all that kind of thing. So but obviously with yours, was you ever loan working at all? Yeah. So that's it. They must have looked at the risk.
I did have a couple of seizures in space about 2 or 3 months. It was.
Yeah.
And I was loan working at that time.
Right. Okay.
The first time I had it, the client actually rang the office and saying there was a carer on the floor and he didn't know what to do.
Right. Okay.
But luckily, one of my mum's other employees lived over the road from him. So she came straight round.
Right.
Made sure I was all right, rang my mum, and then that was there.
Yeah.
The next time I had one was about 2 or 3 months afterwards. And I felt it coming on. And I rang my mum and I said, Mum, I think I'm going to have a seizure. So she came and I had one.
Right.
But yeah.
So have you always had auras? So
not all the time.
No.
Sometimes it can be a bit unpredictable.
Yeah.
But I'd say 80% of the time I do really know when they're coming on.
Yeah. Do you want to sort of say what your understanding as far as an aura is concerned?
I'd like to hear Joe's experience first, and then I'll talk about generic if that's all right. So what do you experience? How do you know when one's
Usually I go a bit fuzzy.
Yeah.
Like my vision starts to go a bit and everything like seems to zoom out and in quite a lot. My muscle joints get quite almost like a pins and needles kind of feeling.
Right, okay.
So that's when I'm aware that I'm going to have one.
Yeah.
And then my perception on time goes out the window too. Right. So
does it seem to lengthen or shorten? Or,
it's hard to explain, but
feels like it's just distorted.
So generally people do feedback about it's kind of like being on a ride a little bit. So it might be that nauseous feeling, a butterfly feeling, so a kind of like an up and downness. We tend to hear it described as a fairground
it's
ride.
Almost like going on a roller coaster.
I've heard it being described exactly like that as well. Some people say that their taste and smell changes a little bit.
They're the ones I've heard of.
Related
to I've got a certain smell or I've got a certain taste in my mouth, and that lets me know.
That's it. So a lot of dizziness, changing what we smell, what we taste. Some people colours might change and things like that. I think this is why it's labelled aura, if you believe in auras. Not that you do, but other forms of auras. We see auras around people anyway. But it's usually described in that kind of way. So, but that fuzziness as well, I've had that being described a few times, definitely.
I remember many years ago that I heard that some individuals get deja vu.
Yes, deja vu.
And deja vu.
Yeah, that's another one that I get. Like sometimes I have like a memory and then it happens like immediately after. And I'm like,
right.
Yeah, that happened so a long time ago or something. And it's like,
Well, I've heard that's so an aura essentially, as I understand it, and correct me if I'm wrong, but an aura is basically a partial seizure. So it's part of the brain being affected by this kind of electrical malfunction that then is an indication that it's about to kind of take over the whole brain. That's have I got that right?
You have got that right. And I think it's worth just saying what epilepsy actually is, because we've not said that.
We haven't really said it, have we?
So someone with epilepsy described it really well to me. She just said, imagine all your lights are off inside your brain and then one light comes on, but then the rest of the lights come on and just in that area and they're all burning so bright. And she just explained it that it was just too much electricity inside different areas of her brain. And it affects how people have a seizure, maybe how long they have it for, affects what happens to them before and then after the seizure as well. So partial is just probably one area on one side of the brain. And that's where you can get auras with the partial.
Right, okay.
But with the aura, it is usually because it is going to spread to both areas of the brain or both hemispheres.
Yeah.
So you've got sort of 3 different types. You've got your partial focal seizures, so one area. Simple partial focal seizure can go anywhere inside the brain.
Yeah.
So where it goes can actually impact on what happens to that part of the brain. So say if we had it inside the temporal lobe, we might get a bit of memory loss after, because that's where memory lives. If it goes into the front part of the brain, frontal lobe, that might affect that part of the brain in the change of behaviour for a little bit after. But usually people do tend to return to normal after. So, well, their normal ways after, definitely. Yeah. But then we've got complex partial focal seizure, which means it covers one whole hemisphere and not just one area of the brain. And then generalised seizure is both hemispheres. So,
The generalised is where you tend to get your typical seizure state, isn't it?
Yeah.
Kind of the whichever type it is, tonic, clonic, or just to explain those terms. I don't know whether you're familiar with those terms, tonic, clonic. Before,
there's quite a few.
It sounds like a drink, doesn't it? Like gin and tonic, clonic. But yeah, so tonic tends to be rigidity, doesn't it? And clonic is the convulsions typically. And then you get different combinations of those two, or just one, or just the other.
It's really hard because they all sound very similar. So you've got myoclonic, tonic-clonic, tonic, atonic, absent seizures. Yeah. It's really worth knowing. So anybody that does support people with epilepsy, if they are medicated and things like that, especially in the work that obviously we've all done and what we do, it would be worth knowing what type of epileptic seizure. And usually the neurologist will let carers know and things like that anyway. But if you are supporting anyone, just look it up on YouTube or look it up on Google, because it's really worth knowing the signs and symptoms of that particular seizure.
And usually it's done in the yearly first aid refresher, so people know what it is.
Know what to do in the action. But I think one of the interesting things I found when I did do some work around epilepsy, I think you mentioned, if I've got this right, the myotonic seizure. I believe that they don't necessarily, or individuals with that don't actually kind of blank out or unaware, their muscles just suddenly do random movements and things like that.
So did you mean myoclonic?
Myoclonic. That's
it. It's so easy to get the language mixed up, but no, you're right. Well done.
Thank you very much.
You're very welcome.
One of the things that I didn't realise though is so absent seizures. I think I thought were partial seizures.
No, not always. So absent seizures, let me just go back here. They're generalised, so it means whole brain. Yeah,
I think the reason for that. So have you ever come across absent or heard of absent seizures before? You have, I don't know if you covered it on first aid training or something, but there's children out there who have that and it's not recognised. It's sometimes perceived that they're daydreamers or ignorant or rude
in their own world.
In their own world, because that absent seizure could just be where they kind of just zone out for a second, and you might get a little bit of eyelid flickering and chewing and things like that, and then they kind of snap back out of it again.
Yeah, they can have those up to 100 times a day. So it's a lot, but usually those ones are not overly harmful. I'm not going to say they're never, but they're not usually
lower level intensity.
Yeah, that's it. Yeah, and a lot of people that have the absent seizures, children in particular, do tend to grow out of them as they get a little bit older. Yeah.
I know with the focal seizures as well, which are the partial seizures, some individuals can kind of keep walking and talking, but not be aware of what's going on. So there's a vulnerability for them kind of just walking into a road and not being aware that they're walking into a road.
Yeah.
And that's a focal seizure as well, isn't it?
That,
there's none of the convulsions that people think about around epilepsy.
Yeah. It's worth just noting then that there's just been some language changed. So I always go to epilepsyaction.org because that's the most up-to-date information around what's the name of certain seizures and things like that. So there's lots of different wordings and things like that. Even in America, some of the terminology is different to what it is here in the UK. So I'd just always be aware of that if you are researching into epilepsy, and just, because it can get so confusing. Yeah. It can get really confusing.
You don't need to name all 40 different types, do they really?
But on Epilepsy Action, there is videos that actually demonstrate what this type of seizure may or may not look like, or those sorts of things. We use it a lot in our training. So we use school videos. They're not traumatic in the slightest, but they're really good ways of recognising, okay, so that would actually be classed as a tonic-clonic or whatever else it could be. Yeah, that's it. So it's definitely worth knowing and researching if you're going to have a look.
Have you mentioned the first seizure you had, where you actually injured yourself and you hurt your arm, I think you said. Have you injured yourself on any of the other seizures at all? Yeah,
quite a few head injuries.
Right, okay.
Last one I had, cut my head open.
Right.
So I have got scars on my head, which are from there now. And then another one was another head injury as well.
Right, okay.
But other than that, not really injured myself. I've kind of been around people.
You got the scars to prove it, kind of thing. Yeah.
I've kind of got people around me usually, so usually they remove all danger.
Yeah.
But obviously, and you're alone, it's a completely different.
Yeah, definitely. And so I was thinking about the reasonable adjustments. You're right. I think it's 100% hard if you don't know when they're coming and stuff. But I think I remember reading a statistic years ago that the individuals with epilepsy are one of the most significantly underemployed groups, as far as maybe there's some understandable as far as vulnerability of lone working or driving could be a factor that's related to. But I remember kind of looking into it at the time. I think it was equality and diversity training I was doing, and they sort of said there is still reasonable adjustments, like having a place, if somebody is more likely to have a seizure if they're tired, then making sure they've got somewhere to go if they are tired, to rest or to relax for a moment, or if it's stress, for instance, it's just that your stress levels have been monitored a little bit to make sure you're not overloaded with work and those sorts of things, that there might be reasonable adjustments. So I think there is some things that it's worthwhile employers being aware of. But the other thing that you mentioned there, one of the things that your school friends and the teachers, big reasonable adjustment is making sure people know what to do in the event of a seizure.
Yeah, so I think keeping training, make sure people have the right training.
Yeah.
Obviously, with the profession that we do, first aid training is done yearly.
Yes.
So a lot of people know what ones are. 100%. And it's not just me who might who has seizures. Residents have them as well. So obviously they are aware and they can put measurements in place. I mean, with the breaks, if I'm one of those people who's at work, I don't like to be quiet. I don't like to not be busy.
Yeah.
So for me, going out and have it and asking for it
wouldn't suit you.
No, and I would feel quite bad about it as well.
Yeah.
Because you'd say it's not fair on other people. So I'm one who just likes to usually just get on with it and just get on with working. So
have you ever had because I know that one of the things we talk about in first aid as well, so you got the timings, and we've already mentioned the kind of the 5-minute threshold, which is a thing in first aid that if it's over 5 minutes, you call 999. I know that's one of the things that some individuals with epilepsy don't want an ambulance calling because there's nothing they can do and they feel like they're wasting the ambulance's time. Obviously with head injuries and things like that, then it becomes irrelevant. You're now dealing with the head injury more than epilepsy. Have you ever had the ambulance called for you? And and how did you feel about that? Did it affect, or were you kind of...
So, I mean, I think I've had about 11 seizures in my life.
Right, okay.
Which is what I can remember. Yeah. So, first one, obviously,
ambulance.
Mum wanted the ambulance out because she wanted to know what was going on. She didn't know anything about it at the time. When I had the ones in school, they got out an ambulance, but I never went into one.
Right.
And that happened for quite a while. And then obviously when I had my head injuries, they did call out ambulance just to make sure. And then the last one I did have a head injury on that one as well. But the waiting times for the ambulance was like 6 or 7 hours. So Mum drove me to hospital.
Right.
So...
yeah. So you have been checked over a few times then, as far as just going, because I think that's one of the things, isn't it, where they should or shouldn't and stuff. But I suppose it's err on the side of caution to a certain degree, isn't it?
Yeah. I think there's a lot of people out there that do feel uncomfortable, especially when it comes to our service users and the people that we look after, that in some care plans, we don't phone an ambulance. If they've had the rescue medication, it's worked and they're okay, we don't phone them. So I looked after one individual, she was 15, and her seizures centraled around menstruation. Right. So we kind of had an indication and we knew, but in her protocol, it was never to phone an ambulance. It was to get her comfortable, let her sleep, make sure she had a rescue medication, and that was that. So it just depends on the individuals. But I do think there's carers, and I know I've been worried, like, oh God, do I phone an ambulance and stuff? I personally think, if ever in doubt, always call an ambulance. But also, of course, if they're unconscious or if they're not breathing and those sort, you just follow all of those things that we've been taught in first aid.
I mentioned to my employer, I said, unless you think that there's been a serious injury or something, I said, never call an ambulance, just always call my next emergency contact. Get them to come.
So it's so individual.
So that's what I said to them. They said, don't worry about calling out an ambulance every time because it's not needed. But unless you think that I've had a serious injury or something.
And that's it, isn't it? That having that conversation with you, going, look, what's your preference? What should we do? And stuff like that is.
I think a lot of employers are starting to get a bit more comfortable with employing people with epilepsy. I remember I went for a job once and I mentioned it in my interview and I didn't get the job. So, but I think people over the past 5 years since I've been working have become a lot more comfortable with employing people with epilepsy because there's a lot more support now and a lot more things that people can get to help out.
Definitely. I think across the board as well with the other aspects of your life that are differences. I think people are generally getting more comfortable of going, just because somebody has a difference doesn't mean that they are not employable or can't do a good job. And I think there's a general improvement in stigmatization and stuff like that across the board. So is there anything that you kind of wanted to ask around epilepsy or anything? Do you feel?
Well, it's just something that I come across very often. So I did support another individual with epilepsy and she hadn't had a seizure for 3 years and she was on medication and she really wanted to come off medication. So she supported her to the neurologist and she says, I've not had a seizure for 3 years. And they said, but you've not had the seizure for 3 years because you've come off the medication. I'm not saying that everybody that has to stay on medication for life or anything like that, but I don't know from your perspective, Joe, are you happy to take the medication?
I am. I mean, I was in a similar boat. I had about a gap of about a year where I wasn't on medication. And I was doing quite well. That year, I was managing to stay with my seizures, didn't have any. And I grew a lot. So then my body kind of was adjusting and I had to go back onto my medication. But for me, I would always say to people, don't risk going off medication because it probably will and you end up having more seizures. So my advice to people would be probably stay on medication. It's just something that people will have to get used to.
I suppose I don't know what habituation's like around medication though in epilepsy. Would it be a case of they constantly have to keep upping the doses over a period of time?
So from my experience that didn't happen, but it just kind of depends on frequency, intensity, all those things. So neurologists I think will find lots of different ways, and if they find one medication that suits that individual, they will continue to stick to it and stuff like that. But obviously things change, so there's a lot of people out there wanting to get pregnant, so they have to be careful which medication they're taking and things like that. It's changing circumstances. Again, other medications may interact. Loads of different things. Even being ill can impact on a person's interference and all those sorts of things. So, but usually most people do take that decision to carry on. But I can understand why it might be daunting for other people to be like on medication for life. I get that. I completely get that. So just individual.
I think it's important to mention, obviously, you should only come off under medical advice if you're going to come off.
Don't wean yourself
when I was first taken off my medication, so what they did with me is they started by lowering down the dosage.
See where they had
so I had a gradual reduce of the amount I was taking. And then I came off it after, I think it was a period of 6 months. So I was on 1,000. I was on that for 2 months. Then I was on down to 500. And I was on that for about a month. And then they got me down to 250.
Right.
For another 3 months. And then they took me off it after that.
Yeah.
So
I think that's that must be quite a big decision to make from an individual point of view, though, as far as, okay, if we're lowering my dose to sort of see whether I still need it, but then obviously you work so hard to like get your driving license, and you've got to be a year before you're allowed your driving license, and then it's that case of, if I stop though and have one, then that's not me driving for a year. So it must be a really kind of big way up, isn't it?
The DVLA now say you can drive on the Epilepsy medication, so don't feel like just because you want to drive that you have to stop taking your medication, because you can still drive.
Yeah.
Even when you're on medication, if you've been a year free.
Yes.
So
what I'm saying is, if you drop your dose down and that then means you do have a seizure, then you're back to potentially waiting for a year again.
Yes.
Before,
I mean, sometimes
isn't it? Yeah.
Sometimes you can get an exception off the doctor.
Okay.
So the doctor sometimes can write saying, yes, had a seizure, but this was down to the medication being reduced. So it might take a while for the body to adjust to it.
Yeah.
Maybe it's not so much a year that you can stop driving for. Maybe it'll be for 3 months or something, just into
that time.
And then they'll give you your license back and stuff, and then you can carry on.
That's good, worthwhile information, kind of knowing, I think, into it for us.
Yeah, definitely.
Okay, fantastic. I think there was one other thing I've got mentioned here, and you mentioned it related to language. Have you heard the term fit before, or having a fit?
Yes.
Does that bother you as a terminology or anything?
No, not really. I think it's the common word for it, and it's obviously people used it in institutions years ago, and I think it's just grown throughout the times, and people use it still. I mean, it doesn't bother me. Yeah, it's just another word that people use for things. So
I was saying to Andy, I was at the Goose Fair on Friday, and one of the rides said, "Do not ride if you have epilepsy. Do not ride if you have fits." I was like, okay. I was like, I don't know.
Were you saying it's because it had a connotation around like a child having a fit, like a paddy?
So when I've spoke to other people, they've sort of said, well, fit, like, a fit is something that you say when a small child is not getting their own way sort of thing. But I think it's individual again, isn't it?
I've never heard it used in that context. So I don't think of it as having a fit.
Maybe it's just Leicester language. I don't know.
That wouldn't surprise me. So, okay, fantastic. Well, thank you so much for joining us, Joe. That was really useful and some really good information there. And it's nice to hear that kind of lived experience and what you've experienced. But actually, it sounds to me like epilepsy has just been a very, very small part of your life, and it's just something you've encountered. In some ways, it's almost like I had a tough day today, and but especially now that you've come out and got the medication sorted and getting to drive and stuff like that must have been frustrating for a while to kind of wanting to do that and have that thing to aim for and not being able to. But it sounds like you've kind of it's just a very small part of your life. By the sounds of it, which is good. Yeah, really good. I don't know whether you had anything else to add.
No, other than just thank you. And obviously thank you for talking about the rescue medication as well. Because I think, again, if people are supporting people with epilepsy, they do need to be trained in it.
Yeah,
so promoting us a little bit here, but at the same time, it's called rescue medication for a reason. Yeah. So there does need to be a standard that needs to be met. Make sure that we've got the correct dosage, right person, all that kind of stuff as well. So get yourself on some epilepsy training if you need to, even just awareness, but then the rescue medication as well.
Absolutely. Yeah, perfect. Obviously, we could recommend a company, can't we?
Yeah, of course.
All right. Well, thank you so much for joining us, Joe. That's been really appreciated, and thanks a lot. Cheers.
Thank you.
No worries. Thank you.